Hi, I'm Dr. C.C. Wong, consultant orthopedic spine surgeon based in ALTY Orthopaedic Hospital, Kuala Lumpur. I treat all patients with spinal disorder from the cervical, thoracic, and the lumbar spine. So basically, the Brainlab Navigation System is an image-guided surgery. Let's say I'm performing a posterior surgery to the spine. After exposing, I could only see this part of the spine, but I couldn't see anything that is in front because it's blocked by the bone. One of the commonest reasons to use this is in a situation like this, where we insert what we call the pedicle screws in the spine. This is the commonest way of spine surgeon stabilizing a patient's spine. So if the screw is not placed correctly, you can harm or irritate the neural structures. And this is something which is very undesirable. As you can see here, this will be what it will be like during the surgical procedure. So during the surgery, we were to do this procedure. And here you can see that this is the screen of the Brainlab Navigation System, where you can see that before you insert the screw, the software is able to tell you the direction of the trajectory of the screws on this axial cut and also on the sagittal cut, and also the bull-eyes view. So in this way, we can be very sure that the screw is exactly the place that we want it to be. When we perform a procedure in the spine, accuracy is quite important, especially when we talk about inserting a pedicle screw. For example, in a patient with a deformity of the spine, we can be putting 20 of these pedicle screws. You just need one of them to be not in the right position, and the operation will not achieve its optimal outcome. So the procedure will be very facilitated by this technology, which means that the surgery will be faster. We are a lot more efficient. So if we can perform a procedure with a shorter period of time, the wound exposure is shorter to the environment, so wound infection, bleeding also will be less. Of course, the biggest benefit will be we do not have to worry about the screws not being in the right place and having the patient suffer the consequence of this part of the procedure.